Good morning everyone. Today we are going to see a topic is intestinal tuberculosis. So intestinal tuberculosis is a common condition. We can hear about the pulmonary tuberculosis, that means lung tuberculosis. But the tuberculosis, that means the mycobacterium which causes the tuberculosis. This mycobacterium can spread bone, intestine, skin and some other parts of our body. So now we are going to see about specifically about the intestinal tuberculosis. The definition of intestinal tuberculosis is a chronic condition wasting disease characterized by a rough-like appearance to the intestine. That means this is the rough appearance of an intestine. So, the etiological factors of tuberculosis, that means intestinal tuberculosis, is cirrhosis, HIV, that means human immunodeficiency virus, is some of the infections, diabetic mellitus, underlying malignancy, that means cancer cells, and malnutrition. These are the common etiological factors about intestinal tuberculosis. The mechanism of pathogens, that means the mode of transmission of pathogens, is swallowing of the infected sputum. Hematogen is spread from active pulmonary and miliary tuberculosis. The ingestion of the contaminated milk or food, contagious spread from adjacent organs. These are all the mechanism of pathogens. The types of intestinal tuberculosis is there are two types. One is primary intestinal tuberculosis and another one is secondary intestinal tuberculosis. The primary intestinal tuberculosis is the patient getting from either the unpasteurized milk or some of the infectious. The secondary intestinal tuberculosis is the patient get from another infected person or another organ infected by a tuberculosis. These are the reasons of the primary intestinal tuberculosis and secondary intestinal tuberculosis. This is the tuberculosis of the intestine caused by ingestion of the unpasteurized milk which contains a Mycobacterium bovis, that means from the animals, cow. This is the primary intestinal tuberculosis. The secondary intestinal tuberculosis is which occurs in a patient of the active pulmonary tuberculosis who swallowed the cuffed up sputum and the lesions are developed in the intestine secondary to the swallowed material. The common sites of intestinal tuberculosis is ileum. Ileum is the most common site of intestinal tuberculosis. Pathophysiological factors, these are the pathophysiological factors, that means this is ingestion of the contaminated milk products. Another one is hematological spread, that means from the blood infection. Another one is spread from adjacent area of the lung, the nearby organ of the lung are affected, and the swallowing of infected sputum, that means from lung. So the pathophysiology is ingestion of the infected milk which leads to entry of bacteria into the mucosa, which leads to granules in the submucosa, which leads to cessation of the necrosis, which leads to ulceration of the overlying mucosa, which leads to spread into the deeper layer of the intestine, which leads to spread into the adjacent lymph nodes and peritoneum. These are the way how the pathophysiological activities are working here. And we are moving to the clinical features, that means sign and symptom of the patients. If any type of TB, the patient suffered from the weight loss, severe weight loss and cough. These are the two main symptoms for any type of TB. That may be a pulmonary TB or lung TB, bone TB, skin TB. Any type of TB, the patient get weight loss and cough. So loss of weight, anorexia, recurrent diarrhea, low grade fever at evening time, cough, distended of the stomach. These are the common symptoms. And the complication of intestinal obstruction, there is the blockage in intestine. So this is intestinal obstructions. Another one is fistula or even abscess, that means the sac-like content is there. Another one is perforation with the resulting peritonitis, that means peritonitis means inflammation of the peritoneum, that is peritonitis. These are the three main complications. Another one is diagnosis. The endoscopy is the best method to diagnose any abnormalities in a colon, that means stomach and intestines. Another main preliminary test is Mantox test for the any tuberculosis. That's when they injected some amount of solutions that contains a bacteria that they enter into our skin. If it is inflamed more than 9 mm, that means the infection is positive. So this is the biopsy or endoscopy and Mantox test, chest X-ray for pulmonary TB, abdominal X-ray for with or without barium hiding the symptoms, ultrasound and CT scan. Another one is medical management. In medical management, that is the course of management. That means the 2 months therapy. One is isoniazid, rifampicin, ethambutol and pyranniazid. Another one is 7 to 10 months. That is the this combination isoniazid and rifampicin. The surgical management, if any part, that means ileum or peritoneum is affected, means it can resection. That means cut and remove that affected area and rejoin anastomosis. That means the rejoining into the another part of the colon. So this is the information about the intestinal tuberculosis. Thank you.